Dear colleagues, today I want to share with you a previous online lecture about symptom analysis. I am Babangida Rufai. Introduction. The knowledge regarding signs and symptoms is the basis and one of the foremost important aspects of medical practitioner. Every medical practitioner has it's most for him to know knowledge, to have a knowledge about signs and symptoms. With the knowledge of signs and symptoms, a healthcare provider will solve 70% of his patient problem. Physical examination will be used to provide more clue based on what we have heard from the patient history. While laboratory diagnosis are there just to confirm or refute your finding. What is sign? Literally, sign means an object, quality, event, or an entity whose presence or occurrence indicate the probable presence or occurrence of something else. Medically, a sign is an objective observable phenomenon that can be identified by another person. So a sign can be identified by another person. It is also a manifestation of disease that the physician perceived from the patient. Example, a runny nose from the patient suffering from common cold. So you can see a patient is having a common cold, you can see runny nose from him, and rashes from a patient suffering from skin disease. You can also observe some rashes from the patient suffering from the skin diseases. A symptom is the subjective experience of a potential health issue which cannot be observed by the physician himself. The physician cannot observe symptoms from the patient unless the patient describes it himself. Example, loss of taste or smell. You can't see a patient who has lost his taste or smell unless he tell you that, hey doctor, I miss my taste or smell. Fatigue and thirst. All those are symptoms that as a healthcare provider you cannot observe them unless the patient himself told you. Then after understanding the signs and symptoms, then there are some terms that you need to understand. Those terms are two. One of them is acute condition. What is acute? You have heard of acute. What is acute? Acute are conditions which are severe and sudden and of sudden onset. Usually acute conditions require immediate intervention. Examples: shortness of breath, dyspnea, fracture, and bleeding. Those are conditions that require immediate intervention, and most of them are of severe in nature. And chronic condition. What is chronic condition? A chronic, it is persistent or long-term condition, usually mild in severity and mostly untreatable condition. Most of the chronic condition cannot be completely treated, but they can be controlled. Chronic conditions are mostly controlled, and they may or may not require urgent intervention unless for attack, episodic attack. Most of the chronic conditions have attacks like asthma, diabetes mellitus, hypertension. So, what are the common signs and symptoms? The common signs and symptoms. Common signs are cough, skin rash, vomiting, diarrhea, bleeding, paleness, jaundice, and edema. I told you that sign is an observable things that as a healthcare provider you can observe from your patient, but symptoms is a subjective. You cannot observe symptoms from the patient, but he will tell you, like abdominal pain, headache, toothache, depression, dyspnea, and fatigue. Those are the signs. How to analyze the signs and symptoms? First, in order to analyze signs or symptoms, there are something you always need to consider. One, the way which your patient is presented to you, either in an emergency or non-emergency condition. In case of emergency condition, you have to do repeat assessment, provide initial intervention first. Then, after the patient stabilizes, you continue to analyze and provide a definitive diagnosis. 2. It depends on whether the patient will describe his problem to you if he is adult, alert and conscious, or you may obtain your history from caregiver if the patient is a child or unable to do so. Or you may get your information from the first aider, witnesses, and people around the patient in case of unconscious patient. analysis. How you can analyze the symptoms? There are some terms that we always use in terms of symptom analysis. One of them is onset. You have to ask about the onset of the symptoms always. Whatever the case, you have to know the onset, because onset differ. It may be sudden for most of the acute condition and gradual for chronic condition. Duration. What are the duration? For how long? Short period, minute to hours for acute condition mostly, and long period, days to week for most of the chronic condition. And you need to ask about the character. Maybe patient having a headache, so you need to ask about the character of the pain. Was it mild, moderate, or severe? Volume. You also need to ask the patient about the volume in case of quantitative symptoms like sputum, bleeding, diarrhea, and vomiting. You need to ask the patient to quantify the volume of the vomiting or diarrhea or bleeding. Site. In such case of pain, patient needs to describe where he feels the pain so that you will apply your anatomy knowledge. Example, patient came to you with an abdominal pain, so you need to ask the patient where in your abdomen you are having the pain. Maybe he will press his right iliac region, so you know many of the structures that are in the right iliac region, and directly you will understand that the patient is having so kind of condition. Radiation. The pain may or may not be perceived from its original location. From your anatomy lesson, you understand that when you are having pain in some place of your body, it could be radiated to another part of your body. That is the work of your nervous system. It may be perceived in both original and neighboring sites, like in appendicitis. A patient may be having appendicitis and he will have a pain in his right iliac region, and still he will have the pain in his umbilicus, in the umbilical region. Then you need to ask about aggravating and relieving factors. The patient condition may worsen with some activities and or taking food or changing weather or position. And it may also be relieved by something of that nature, either taking some drugs or stopping of activities or removing from the situation. So most of the patient, they know if they do some kind of activities, their symptoms will get worse, and if they do some kind of activities, it will be relieved. Those are the modalities you need to apply when interviewing your patient about his health condition. On every sign or symptoms he presented to you, you need to explore each problem specifically. Example: a patient presented to you with multiple complaints. First, you need to write the complaint in a patient words. Example: if you said, doctor, I am calling upload. Do not write hemoptysis. Avoid medical jargons, unless if you are interacting with your colleagues. Write it the way he stated it. The patient said he is calling upload for how many days. And write the complaint in order of chronicity. Example: fever for 5 days, fatigue for 3 days, vomiting for 1 day. After that, then you write the history of his complaint, history of presenting illness. In our previous lecture on history taking a physical examination, I explained to you what are history of presenting illness. In history of presenting illness, you need to ask about everything regarding that symptoms or sign, onset, character, and others. Example: a 25-year-old male student single came to the clinic with the complaint of fever for 5 days, which he described as rising and increasing in severity, with fatigue for 3 days, which said to be started following the fever. And also, patient described he started vomiting, which he said it is the same as the food he had taken hour ago. And the volume of the vomiting may fill a cup of tea, 250 to 250 ml. No history of headache, dizziness, abdominal pain, or diarrhea. He has never been hospitalized, but his two roommates had similar condition last week, but they did not go to the hospital. In this story, there are 3 colored things. The first one, black one, is the text colored black. It means this is the history of his presenting illness. The history colored blue is what we call systemic review. So you need to revise some of the system or all of the system. You need to ask about similar condition and others. The one that has been colored in red is past medical history. You know to know about the past medical history. Has he been hospitalized? Does he have any similar condition before, and so on. And there are also like family history. You know, he has two roommates who have similar condition previously, but they did not go to the hospital. Then you suggest and support your diagnosis with physical examination. Finding on examination, after you examine the patient, the patient look very tired. There is evidence of paleness and dehydration on his body. There is no skin rash, no other anomalies detected. The presented complaint are suggestive of febrile illness, such as malaria or typhoid fever. And then to confirm your diagnosis, you have to send your patient for laboratory diagnosis. We have general or routine, and we have specific laboratory investigation. General, such as PCB, complete blood count, renal function tests, and others. Those are general examination, general laboratory investigation. Then we have specific laboratory investigation. So the specific tests are those which a test that will detect the problem of your patient, like malaria test, typhoid test, STI screening, and others. There are specific tests. Thank you. This is the end of this lecture. If you have a question, you will ask it in a group, or after watching this video, you will ask your question. I'll answer it. Thank you.